01, so we can go ahead and get started. I just want to welcome everyone. My name is Deborah Roseman, and I work at the National Program Office for Aligning Forces for Quality. I know that we have some folks on the line who are familiar with Aligning Forces for Quality, have been involved for some time, and some of you may be new to AF4Q. So I just want to take a moment to give you a little bit of background. But before we do that, I just wanted to take care of a couple of little housekeeping issues. Wanted to remind everybody that we've got everyone on mute right now, and we will be happy to take you off of mute once we get to the question and answer segment. But to reduce background noise, we've got everyone on mute for the moment. We've set aside plenty of time for questions at the end. If you are on Twitter and would like to tweet during the webinar today, we certainly encourage that. The hashtag, as you see on your screen, is AF4Q. And although I'll get back to this later in the webinar, we have some additional resources that are on the website, on the Forces for Quality website. You'll see the URL on the screen there. Again, I'll refer back to that later in the webinar. But just to introduce those of you on the call who are not familiar with AF4Q, Aligning Forces for Quality is the signature effort of the Robert Wood Johnson Foundation to improve healthcare quality and reduce costs in 16 targeted communities across the country. The focus of AF4Q is about aligning all of the groups that have a stake in healthcare, the people who provide care, like physicians, medical providers, and hospitals, pay for care, like health plans and employers, and get care, like patients and caregivers and healthcare consumers. So the foundation, the Robert Wood Johnson Foundation, believed from the beginning of the project, and we found during the last 8 or so years of AF4Q, that patients and consumers have important roles to play in the work to improve care in these communities. And one of the ways the consumers influence that work is by sharing their stories. Stories about what the healthcare system is really like for them, of successes and challenges they've had in their communities, and more. And I know probably many of you on the phone have had experiences where you've either heard a story that was powerful or had an experience telling your own story. One of the great things we get to do here at the National Program Office is bring together representatives from across the communities to learn with each other, learn from each other. And in May of this year, representatives from all 16 communities got together, including consumer representatives from the communities, and the consumers spent a day together learning and practicing how to tell their stories in a powerful way. I know some of you on the phone were there at that meeting, but for those of you who weren't there or who would like a refresher, that's why we're doing this webinar today, to try to capture some of the content of that session, as well as share a few great examples of well-told consumer stories. As I mentioned, though, this is really just a start, one set of resources. There are additional resources on the website that you can access for more information. So I want to thank HCM strategists for helping put together that event in person with the consumers, as well as this webinar today. And with that, I'll turn it over to Michael Manganello from HCM strategists.
Deborah, thank you so much. And to everyone on the webinar today that I met in San Diego, great to be back with you. And to all of you new people, we're really hoping that at the end of this, you are given some tools to tell the amazing stories that are going on at the alliances all across the country, and how storytelling can actually impact. And you know, my team was brought on to go to San Diego, and prior to that, to sort of start to hear about your stories, and there's so many of them, and to help you kind of craft your story in the audience. And we sort of gave a seminar at San Diego, and what's so thrilling today is that I'm not going to do that today, and my team's not going to do that today. The consumers, your own consumers, are actually going to tell you how to tell a story, or help you to tell a story. So it's really thrilling. I was, aside from doing a sort of a seminar on storytelling, I was also privileged to be on a panel that was the power of consumers and storytelling, not just about healthcare, which is where your space is. And so I sat on it with a kid named Travis from Dell Computers and a woman from Amtrak, and it was fascinating because the power of the consumer made changes happen in real and tangible ways. So I'm not going to that end though, I think I'm just going to tell you one quick story because everyone's going to be, sharing sort of strategies about how to tell your story. But I was going to give a sort of to the point of when I did the panel about outside of healthcare. This is a little bit outside of healthcare. It's about research, and it's about the power of the consumer, what we'll call them the patient. And this was the Cystic Fibrosis Foundation. This happened this year. So I don't know how much you guys know about cystic fibrosis, but it only affects about 30,000 kids. And it's a terrible disease. It affects their lungs, and most kids don't live past 20. So the Cystic Fibrosis Foundation did a tremendous job of galvanizing their advocates and galvanizing the research and galvanizing sort of a strategy moving forward in terms of a potential cure or intervention for cystic fibrosis. But so the FDA, this is the challenge. Your guys' challenges might be a doctor's practice, a hospital. For cystic fibrosis, it was the FDA, the Food and Drug Administration. They had a drug that showed that they could help 4% of the population of cystic fibrosis kids. The FDA was like, no, that's not significant enough for us to move you down the pathway and to approve a drug. Well, the Cystic Fibrosis Foundation decided that 4% of these 30,000 kids was 1,200 kids, and that was worth the fight. They organized this tremendous strategy that had a bunch of prongs, but one of them was storytelling, and one of them was having the advocates and the caregivers and the parents communicate to the FDA how tremendous 4% could be. Well, I'm going to make a very long story short, and the effort worked, and the FDA approved a drug called Kalydeco 3 months after it was submitted for review, which is kind of astounding in the world of the FDA and the world of drug approval. But it was truly the power of the patient stories that made this happen. And I have to tell you a story I heard from one of the mothers. Every night these kids have to be percussed, meaning they have to have the back sort of hammered to loosen up their chest. And a kid came in to his mother after he'd gone on Kalydeco, and she assumed it was because he needed to be percussed, and he came in to tell them, his parents, that he didn't need to be percussed because the drug was working. And the kid has come off a transplant list for a lung transplant. So I am so excited because you guys have the same power to tell those stories. I'm so happy I can turn it back to Deborah so we can actually start the webinar.
Great. Thanks so much, Michael. And without further ado, I will turn it over to Vizaskia Caldwell, who is a health equity advocate in Washington State, one of our 16 AF4Q communities. Vizaskia?
Great. Thank you, Deborah. I'd like to begin by thanking Deborah, Roseman, and Cody, and the AF4Q team for asking me to be on and speak to you all today. And I'd also like to thank Michael and his team, and especially Bill Winfrey, for the support that he has given me in preparing for this presentation today. So with that said, again, my name is Vizaskia Caldwell. In my professional life, I'm a health disparities manager for the Washington State Healthcare Authority and a member of the Washington Health Alliance and Aligning Forces for Quality Communities. In my private life, I'm a mother, wife, daughter, and I would say a health advocate. And that's the reason I'm here today. Today, I will be presenting on the structure of storytelling, as previously mentioned. And there will be 3 incredible stories that will follow my presentation. Their stories are very unique and with unique outcomes, but they will all exemplify the techniques that I'll be covering today. However, in preparing for today's presentation, it was placed upon me to share a brief story of my own. If I had to title my story, it would be Advocates, Knowledge is Power. The reason being is that I was raised to believe that knowledge is power. That belief was put to a test in my life on August 8th of 2010 when I received a phone call from my husband. He was on a business trip in Chicago, and he said, "Hey, honey, make me a doctor's appointment. I think I'm dying." Now, this is a man that I have spent the last 37 years with, and hasn't been sick, an athlete in high school, a very physically active person. You would never have suspected anything was going on. So I immediately got off the phone, made him an appointment the same day for when he returned. We went to the appointment, and I requested several tests before the physician even got into the office, because as a health disparities manager, I'm pretty aware of his risk factors. He's an African-American man in his late 40s, and he's at high risk of heart disease, cancer, diabetes, and a host of other chronic conditions. Needless to say, though, the physician came in and was somewhat frustrated with seeing all the tests that were being ordered. He thought that water, pills, and rest would suffice. Ultimately, he conceded to my request, and by 7 a.m. the next morning, we received a call, and my husband was diagnosed with end-stage renal disease, end-stage liver disease, hepatitis C, and later diabetes, and he needed immediate attention. And basically for those, that means he has a kidney failure, liver failure, and a disease that was known to be incurable. It was very shocking, not too emotional because it was very shocking. I immediately, well, not immediately, but when we left the appointment, I went to a local business supply store and bought a binder with dividers. It started out with 5 dividers, and by the end of the situation, I ended up with well over 20. The tabs on the binders included contact information, insurance, labs, medication, kidney disease, liver disease, hepatitis C, dialysis, transplant, ER visits, nutrition, advanced directives, general research, a calendar, and needless to say, a notepad, because I always had a lot of questions. On the cover of the binder, though, I put my husband's name in big letters, and it said, "Knowledge is power." I also included pictures of our family members to remind my husband when he looked at this binder that what he was fighting for. And little did I really know that that Knowledge is Power binder was going to provide me with some essential tools that ultimately would save my husband's life. My husband's condition progressively got worse in 2012. While at the hospital, he had collapsed in the restroom, and I had to rush him to the ER. When we got there, they took him back and tried to stabilize him. Soon after they took him back, they brought me back with him and said, "We can't wake him up." I told him, and I spoke sternly and loud. I'm a pretty aggressive type of gal. And I said, "Wake up. You need to wake up right now." And believe it or not, he did. And they were also trying to find information in their system on him, but they couldn't. So I handed them my binder, Knowledge is Power. They asked if there was current information in this binder, and I said, absolutely. They looked through the binder, and they were amazed. All of his labs from that morning, everything was in that binder. They started scanning it. My husband was being treated. He progressively got better. But what I noticed is that my binder was being passed around the ER, the teaching hospital, and they were all looking at it. And I did approve this. A week later, I was asked to come and do a presentation to the Transplant Orientation Support Group meeting for patients and caregivers on how to better be prepared and to advocate for your loved ones. We've since gone back several times. On another occasion, and this is the last one, my husband was hospitalized at a different hospital. I was informed that he needed to be put into hospice, that we needed to allow him to die with peace and dignity. And they asked that I bring my family members in and that the physicians would share this information with them. My family came in. The doctors made a really good case for why we needed to let my husband go in the hospital. However, my husband and my children made an even better case. They said, "Mom, if they can't figure it out, you can." That evening, I reviewed my Knowledge is Power binder from front end to back end, from every lab. I looked for everything that had changed over the course of time that could contribute to his condition. And by 4 a.m. that next morning, after all the research, looking on the internet, I devised a plan. Yes, I devised a treatment plan for my husband. And it was because the Power of Knowledge binder helped guide my path. I had also gained a lot of respect from the medical community because they knew I was prepared. I was able to communicate in their language what I thought and what I felt needed to be done. My treatment plan was put into place, and I will say within 48 hours, my husband's skin color was back. He was eating and walking around the ward floor. And instead of hospice on that day, within the month, my husband did receive a life-saving treatment that he needed. He received a dual and kidney transplant. Now, I need to say this. I'm not a miracle worker. I'm not a medical professional, but I do a lot of research, and my guide did help me have the knowledge that I needed. But I didn't look at my Knowledge is Power guide as a tool to hold the healthcare system or physicians accountable. I looked at this as a tool to provide me with the information that I needed to be the best possible advocate for my husband, and to ensure not only myself, but to ensure my husband that the decisions that I had to make on his behalf would be sound decision, informed decision, and that at the end of the day that he would receive the quality of care that he was entitled to in life-saving treatment. My Knowledge is Power information binder did just that for me. It gave me the tools to be the best advocate. Now, because of the story that my binder has allowed me to tell and to share with other patients, caregivers, community groups, churches, my husband is healthy today, and other people have a resource to help in the event that their loved ones or that they're going through this experience. So now that I've shared my story, I want to help you create your own stories with the information that I'm going to provide. And I'm going to start with, so the title of this is The Structure of Stories. I need to reiterate, there is no one-stop shop here. There are strategies that will ensure that your story is structurally sound and effective, but every story is unique to the storyteller. So there are 3 strategies that I'm going to cover today. 5. It's the power, the steps, the facts, the show, and I'm going to show you how to tie it all together. So we're going to start with the power. Everyone has a story to tell, and your story has power. Your story has the power to drive change. When I told my story, it is with the intention to encourage personal advocacy, health literacy. It's provider and patient communication. It can drive those changes that are needed so that you can receive the quality of care and the outcomes that I sought and that you would be seeking. It has the ability to impact policy. Now, if you think back to my story, I was telling you how that the initial physician, and I must say he was a visiting physician, thought that water pills and rest would have sufficed for my family. Since then, they had to really reevaluate the standard of care and the policies on screenings and labs. So it did impact how my health plan or physicians were looking at why wouldn't we have, based on his risk factors or my husband's risk factors, have wanted those tests. So it has the ability to impact. And then sustain programs. Now, if relevant, connecting your story to an AF4Q program can also lead to sustaining those programs through policy and funding or whatever it is that's needed to sustain those programs. I will say that the Washington Health Alliance that I'm a member with had a resource that I used on a regular basis called Choosing Wisely, as well as Own Your Health. and their resources on how to advocate for yourself or a person that you are the primary health care provider. So those are 3 areas that your story could have the power to affect. Next are the steps to your story. I would have to say one of the most important things is to make it personal. In my position, I hear a lot of stories, and I've told a lot of stories, but the most compelling and impactful stories are the ones that the story is telling that is intimate, that they are intimately connected to. Those are the ones that will grasp the audience's attention and will stay with them. Also, you don't really need a script when it's personal. Have specific goals in mind and communicate those. My goal was to be a knowledgeable advocate for my husband's life and to ensure that he received quality care and life-saving treatment. Now, as far as the facts, I'm going to cover some more facts on the next slide, but I will go to follow up with your audience. When your meeting is over, you need to stay on your audience's radar. You can do this by sending fact sheets that you might have mentioned in your talk, or even connecting the audience with someone that you had mentioned as a resource in your story. I often do this through introductions when I'm talking. I'll connect the person that I'm speaking with or the audience via email to that resource. So keep that in mind to always follow up with your audience. Now we'll talk a little bit more about the facts. The facts are that you have to know who your audience is. Whether it's a provider, consumer, your audience is key to how you tell your story. And some real basic things is to make sure that you use plain talk. It's recommended that you speak at a 5th grade level for most audiences. And what would that mean is, trying to minimize the, I would say, words that have more than 8 letters. But you know what I mean. And then no acronyms. Working for the state, we have binders filled with acronyms, and that's letters for words. If the audience doesn't understand what you're saying, or you're using words or acronyms that they can't relate to, then you're telling the story to yourself. So let's remember, keep in mind who your audience is. And also interest. You have to keep your audience's interest. Now here I have a really great example. Recently, I was asked to speak to about 47 middle school girls of African American descent. They all qualify for free and reduced lunch. I was asked to speak about health disparities, which was interesting, health disparities. And so what I chose to speak on was obesity. And what I shared was, I shared some statistics that they could relate to and some of the risk factors. But I also shared my journey over the course of the last year to lose 130 pounds. And that piqued their interest. But then when I showed them a picture, then that solicited questions. My presentation took about 15 minutes. But the impact of that presentation to these girls resulted in a walking club. They're all on myfitnesspal.com, and now they're working on starting a community garden at their school. So in a short amount of time, you can grasp that interest and make it impactful that they will act upon it. Now, the third thing would be convincing. The statistics sparked the girls' interest in the story I just shared. The pictures motivated their desire and provided the evidence that a healthier life was possible. Now, it's important to remember that this is getting back to the idea of finding out what your audience is interested in. I realized that the picture would convince the middle school girls of the need to be more mindful of their health, and I connected them to what they cared about most, and that was their health. So now the show. So you've heard my story or stories. The following will be the 3 unique, okay, so you're going to hear 3 more stories today. But I would like you to really pay close attention to what I call the show. These are essential components of the story. It's how they open the story. Did they provide an introduction? Introduce yourself. Let the audience know who you are. Make that connection and share with them the purpose of your story. And then, of course, and I don't think you can hear this enough, but make it personal. Firsthand is best. The most compelling stories, again, are those that you have firsthand knowledge of and an intimate connection to. For me, it's also the story of struggle and triumph, overcoming adverse odds. Then state your goal. Let your audience know what your objective is. For me, knowledge was power. Quality of care and life-saving treatment was my goal. And then use facts. Use facts. They can be scientific, anecdotal, or applicable to your situation. But it reinforces your story and your message. And then close by restating your goal and provide the contact information and follow-up. And oftentimes Q&A. Then let's go to the next one. Now let's tie it all together. A well-structured story has a strong opening that provides an introduction and the reason and the purpose behind the story. It is personal, it expresses goals, it includes facts, and has a strong close. If these elements are presented, then your story will have the potential to drive change with your target audience, whether it's an individual, a provider, the legislation, health plan. It can drive change. It also has the potential to impact institutional policies, practices, and laws. And then it needs to be compelling to the point that it would make someone want to act, whether it be on your behalf or theirs. And memorable. Make your story memorable that the audience will be able to summarize the salient points of your story when they walk away. I'm going to stop here and say that there have been times when I've heard stories and when I walk away I might not remember but the name of the person telling the story. And that's not what you want to do. You want to make sure that you make those key points that they could basically summarize your story when they walk away. Tailor it to the audience, like I tailored my presentation to the middle school girls, and your story will be able to motivate and inspire action. Now, hopefully these strategies will help you develop your story, and that I'd really like to, again, thank you for your time and allowing me the opportunity to present to you. Now, I would like you to get prepared to hear 3 truly inspirational stories from around the country. Thank you again.
Thank you so much, Vazaskia. I think she did a tremendous job of both showing and telling us the key elements of stories by sharing her own story as well as laying out the steps. So to drive the point home, we have, as Vazaskia mentioned, 3 really powerful stories to help you learn from the experiences of the folks you're going to hear speak now, but also listen for the elements that Vazaskia pointed out. So we're going to hear from Kathy Day from the state of Maine Aligning Forces for Quality Alliance, and we're going to follow up her presentation with a video. So we'll pause after Kathy speaks and play a video of somebody that she worked with in her alliance and her work that can convey how powerful her story really was. Then we're going to hear from Alicia Staley from the Greater Boston Aligning Forces for Quality community, and finally from Patty Black from Oregon. So without further ado, I'd like to turn it over to Kathy.
Hi, thank you, Deborah, for that nice welcome, and I'm honored to be here this afternoon. I'm a retired nurse, and I'm a patient safety advocate, and I came to that work, the patient safety advocacy, by way of my father's story, which I'll share in just a few minutes. I live in Bangor, Maine, and I'm a member of the Maine Quality Counts Consumer Advisory Council. And I have a really firm belief in the power of our personal health care stories, both positive and not so positive stories. So I took this assignment literally, and I broke it down into the three points that are, I think, on the next slide. Point number one was to identify the problem. In the fall of 2008, my father, John McCleary, was 83 years of age, and he lived independently at home with my mother, his wife of 62 years. On September 26, he fell getting out of bed, and he broke his tibia, which is the small bone in the ankle. The injury was fairly minor, but it required 12 days of rehabilitation, which was done at his community hospital, a small critical access hospital with less than 25 beds. He was discharged from rehab in good condition, according to his medical record, after that 12 days. Less than 2 full days after his discharge, he collapsed with MRSA pneumonia. He woke up that morning, and he was so weak that he couldn't sit up in bed. MRSA, MRSA, or methicillin-resistant Staphylococcus aureus, and I realize I've just broken the no more than 8 letters rule to make it plain language, but I just need to explain about this infection. MRSA is a serious antibiotic-resistant infection that can affect any part of the body. He became completely bedbound overnight because of a hospital-acquired MRSA infection, and he never walked again. Within 24 hours of his readmission, he slipped into septic shock. Valiant efforts of the hospital staff pulled him through that very serious episode. He ended up in ICU for several days, and at that time we were so concerned, as my mother and my family were so concerned that we would lose him, that my mother called a priest to give him last rites. Dad struggled for his life and pulled through septic shock, but his health was in a rapid decline. Over the next several weeks, he lost almost 1/3 of his body weight. He had thrush and a miserable body-wide rash. His skin broke down on his backside. The necessary antibiotics caused ototoxicity, which is hearing loss. So between the hearing loss and the necessity of masks as part of his full barrier precautions, it was really difficult to communicate with him. After 3 more weeks of intensive care and treatment at the hospital, he went into a long-term care center. He died in an isolation room in the nursing home on January 9, 2009, and my mother and I were both with him. This absolutely should not have happened. I'm completely convinced that his infection was preventable. 2 other beloved community seniors had also contracted MRSA in that tiny critical access hospital and died in the few weeks just before my father's stay. Although this would be considered a MRSA outbreak, the hospital had not started to screen anyone, and they had not initiated the steps from the second level of CDC recommendations for MRSA prevention. They continued to randomly room patients together without knowledge about whether or not they were carrying MRSA and or that they may spread it. None of these 3 consecutive infections or the resulting deaths of the victims were publicly reported anywhere as far as I know. The infections were a very well-kept secret, one that, if told, could have helped my father and my family to avoid this deadly infection. A hospital board member who was also a local state representative in my father's hometown, was at my father's wake, and we talked, and he was totally unaware of the problem as well. My very sad story is an example of the importance of healthcare transparency. So we move to point number 2, what do you do about it? 3 beloved community seniors, my father included, had become infected and died in the same hospital in a very short period of time. Obviously, these very serious infections were not getting the needed attention, and or prevention efforts. Better and more thorough steps were needed to protect vulnerable patients while they are in Maine hospitals. So number 3, finally, is finding the way to do it. How do I make this change, this needed change? I researched MRSA thoroughly and connected with experts. Then I engaged my family, community members, other MRSA victims throughout the state, and or their survivors. Then I recruited support and help of the Maine State Nurses Association, the Maine People's Alliance, and my local representatives and other lawmakers in Maine, and took my cause to the Maine State Legislature. Because of our efforts, in June 2009, Governor John Baldacci signed our new law that was passed to screen all high-risk patients for MRSA on hospital admissions in Maine. We also now have a law to report all hospital-acquired MRSA and C. diff, and those numbers are publicly reported in the annual Maine HAI report. HAI is Healthcare Associated Infection Report. Unfortunately, under pressure from the Maine Hospital Association and the new Maine government leadership, the new MRSA screening law was rescinded in 2011 before the efficacy of MRSA screening and isolation even had a chance to make the intended and, on my part, anticipated difference. This was a big step backward for Maine's patient safety in Maine. Sustaining my work and efforts for MRSA prevention has been possible by joining with like-minded advocates in the Consumers Union Safe Patient Project and with the Maine Quality Forum Healthcare Associated Infection Council. So this comes down to my advice for others who have identified an issue that they feel needs attention and action. Number 1, never underestimate the power of your passion and the importance of the healthcare consumer or patient's voice in making improvements. Join with others who share your passion and goals. Number 2, get smart on your subject. Be determined and never be deterred. There will be obstacles and obstructionists. Find a way to work around them or find a way to work with them. And number 3, always be confident that you are fighting for the right thing. Just last week, I joined with my Consumers Union Safe Patient Project network of advocates and activists, and we are instrumental in getting a Senate subcommittee hearing on patient safety. So this is proof that determination does work. And hopefully this work is going to continue and move forward. My early work with the Maine Quality Forum is where I met Dr. Cutler, Josh Cutler. He was the medical director of the organization and therefore was responsible for convening the group called the MDRO Metrics Committee, MDRO standing for Multi-Drug Resistant Organisms. That committee did the rulemaking on the new law in Maine in 2009. And now you'll be hearing and seeing a audio recording of Dr. Cutler's comments on our work for MRSA prevention in the state of Maine. Thank you.
Thank you so much, Kathy. So we are going to show this video now from Dr. Cutler.
Working in the quality and safety area at Maine Medical Center in Portland, Maine. I'm a cardiologist by training. And during the time that I worked with Kathy, I was the director of the Maine Quality Forum, which is a state agency charged with measuring and reporting on healthcare quality and safety all across the state, mostly in hospitals. Her story, which, among other things, expresses the fact that avoidable harm happens to patients, sometimes with tragic consequences. And that is necessary to the discussion and very grounding to the discussion. It automatically creates an attitude of respect by providers for consumers like Kathy, and I think informs the rest of the conversation, which, as I said, is a dialogue, sometimes a debate, about the value, in this case of MRSA screening, which Kathy was advocating for. There are a number of things that make Kathy's story effective. One of the things is the passion with which she tells it. She's very passionate. She's very articulate. She's not afraid to expose the impact of the episode that is her story to everybody and anybody. I don't know whether Kathy mentioned that in one legislative hearing, she actually brought several members of several generations of her family. So it wasn't only Kathy's talking about the impact to her about her father's illness and death. It was also her father's grandchildren talking about the same event. That in itself had a lot of impact. So I think it's the passion, it's the articulateness, it is the sometimes telling the same thing many different ways over and over. The other strength of Kathy, which really developed as time went on, is that she developed from a person, a family member with a clinical background, into one of the most well-informed people in the whole discussion about hospital epidemiology. And she worked very hard to become educated, which I think showed her respect for the world in which hospital providers live and work. And in doing so, I think that she became a much more credible spokesperson for her cause, credible to the people on the, for lack of a better term, on the other side. Stories serve a very important purpose in terms of focusing the discussion and in terms of making sure that everybody realizes the importance and the impact of the actual illness episode. But it's also important to use the tools that are available to move toward a solution. And that's why, in Kathy's case, she didn't just go away after telling her story when we as hospital representatives told her that, thank you very much for your story, now we'll use our science to solve the problem. She actually learned the science, which is not totally clear in this area. There's a lot of debate and a lot of conflict by many intelligent people who are working in the field about how best to control MRSA infections and transmissions in hospitals. And I think she learned enough to appreciate that and became a continued valued member of the dialogue after she told the story. And I think at some point, a consumer advocate needs not to abandon the personal story, but to move away from that into a more expanded field, which includes the issue itself. So it's not, in Kathy's case, just about her dad and redress for the harm that occurred to him and to her family as a result, but it's really about a broader issue of how can we best control the transmission of infections within our hospitals. And that's something that we can work together on after we listen to and process and feel the impact of the story.
So thanks again to Kathy for telling her story, and to Dr. Cutler, who, although he wasn't able to join us today, he had a scheduling conflict, he was able to join us through that video. So hopefully the combination of Kathy's powerful story and Dr. Cutler sharing his experience, having heard her tell her story as part of the process in Maine, it helps demonstrate the components that Vizaskia pointed out. So thinking back to Kathy's story, did she make it personal? Did she use facts? Was her goal clear? And did she follow up? And it was clear, I think, from Dr. Cutler's comments that she did all of those things, and she followed up after the story and held folks accountable. I think similarly to Vizaskia's story, where she made it personal, used facts, and in both cases, it's clear that the goal is bigger than the individual who's telling it. It's important to tell the personal side of it, but in stating your goal, you're doing what Dr. Cutler pointed out and making it more relevant to more than just yourself. And so I think our next speaker is also going to do a tremendous job of driving that point home. So I'd like to turn it over to Alicia Staley from Greater Boston. Alicia?
Can you guys hear me now?
Yes.
I'm the comedy interlude here, so I'll just start with that. Sorry about that technical difficulty. Anyways, my name is Alicia Staley, and I am a 3-time cancer survivor. And today I'm going to share 3 major milestones or inflection points, if you will, on my cancer advocacy journey. And I feel that, you know, over the years as a cancer survivor, I've learned quite a bit in terms of working as an advocate and trying to help other patients navigate the system, if you will, because unfortunately I feel like I've got great experience with a job that you never really want to have. But anyways, so I'll get started with my 3 points. As I said, I'm a 3-time cancer survivor. I was first diagnosed when I was a sophomore in college. I was diagnosed with Hodgkin's disease and went through treatment over a 3-year period, essentially, to deal with the Hodgkin's disease that I was diagnosed with. I had started out with radiation and a combination of surgeries and relapsed immediately, unfortunately. And the next trip for me was with chemotherapy. I went through 11 rounds, actually, of chemotherapy, which was an unusual number. But fortunately, I made it through that. It was quite an experience being in college while dealing with cancer. It was probably the most isolating experience I think I've ever had. I like to say, think of a time before the internet, which is very difficult in some ways to imagine what kind of community you can build without having the tools that are available to us today. I was as a sophomore in college, you know, as a young adult, I really had not met other folks that were dealing with Hodgkin's. So my trips to the cancer center, I was always the youngest one in the waiting room. There was no one else really being treated for Hodgkin's at the time. And I quickly realized that your experience or your cancer journey is very geographically dependent in some ways. Where you're diagnosed, when you're diagnosed, really makes a difference as to, you know, the community of people that you'll interact with at the cancer center or in your support groups. And I found that to be an isolating experience all the way around. In 1994, after I'd completed my treatment, I actually moved to Boston and started my first job and had begun follow-up cancer screenings with my doctors here at Tufts Medical Center, and was doing fairly well. Was going through the basic survivorship checklist plans that were available at the time, and in 2000, my doctor, at the age of 30, my doctor suggested that because of the high dose of radiation I had as a young adult and the amount of chemotherapy that I had, that screening mammograms might be a good idea for me. So I started screening mammograms And unfortunately, I had a mammogram on April 1st of 2004, which I don't recommend that anybody ever have any medical exam on April 1st because that's just not fair. But the mammogram came back with a spot, and it was determined that I had mucinous carcinoma. So I was back into cancer land one more time and had 2 weeks of radiation and some surgery to take care of the breast cancer at that time. When I started on additional oral therapies. By November of 2007, my cancer was back for a third time. And I made the very hard decision at that point that the best options for me at that point would be bilateral mastectomy. So in January 2008, I had a bilateral mastectomy. And one of the big milestones in my cancer advocacy journey actually occurred that spring. In March of 2008, I actually signed up for Twitter, which was, in some cases, some might think it's very trivial, but while I was recovering from that surgery, I signed up Twitter and decided I was going to begin to find a way to create my own cancer community. And one of the very first things I did when I signed up for Twitter was search for other cancer survivors. Immediately returned all sorts of profiles of other people that were declaring in their 160-character biography that they were a cancer survivor, a 2-time cancer survivor, a 3-time cancer survivor. And I instantly followed and connected with these people online and could not believe how quickly and how easily it was for me to meet other cancer survivors in a way that I had never been able to before. Like I said earlier, your cancer diagnosis, the time you're diagnosed, where you're treated sort of pushes you down this path into the available cancer support services that are available at that time, at that place. And what I realized when I joined Twitter was I've just created essentially a virtual support network for myself. And within 24 hours of being on Twitter, I got even more brave, I guess, if you will, and decided I was going to search for Hodgkin's and breast cancer survivors. And I couldn't believe it, but within being on Twitter for 24 hours, I was able to connect with 4 other women that had had breast cancer and Hodgkin's disease. And we were essentially living parallel lives. We had all been young adults in college when we were first diagnosed with Hodgkin's disease. We were all young women in their mid-30s that were now dealing with breast cancer. And I realized that because of a Twitter account, I was able to connect with people that there's no way I would have never run into them, just a matter of course of dealing with my my cancer care team here in Boston. So Twitter for me really, I like to say Twitter shrinks the world. It really brought me and introduced me to communities that I would have never found any other way. And that for me marked a turning point in my advocacy journey when I realized that there were so many people out there looking to network and looking to connect with each other and share their stories and grow and continue to advocate for other people that were essentially dealing with cancer, you know, just starting out their journeys. And I've always felt that a need to give back and continue to work with other cancer survivors as they start in their treatment or go through the sort of the doldrums of the ups and downs of long-term survivorship, that we just have to build this fabric or the community to help each other along the way. From that point, after I joined Twitter, I began blogging on a much more regular basis. And over the years, I had worked and managed to find other outlets in different blogs where I could share some of my thoughts on cancer advocacy and just the state of the breast cancer community. A second turning point for me actually occurred in December 2010 when I wrote a blog post basically examining how the breast cancer community was fractured and a lot of the big name organizations in the breast cancer world were not really staying true to their message of, you know, research and working for a breast cancer cure. That the idea that the pink ribbon had really gotten out of control, and the idea of cause marketing in the cancer community had just, the train had really fallen off the tracks. That we needed sharper focus in the cancer community for research and education. And I was surprised at how many times that blog post had been shared and read and commented on over the years. And to me, it marked a point in my advocacy journey where I realized that I needed to share my story. I needed to continue to share my story, but I needed to encourage others to share their story as a way that we as a community can work together for the best of the community. And to, when we see things that are wrong in the community, make sure that we call it out and not allow larger organizations, big name organizations to sort of roll over these very fragile communities that have built up to take care of each other. And at the end of today's conference, I'll actually tweet out the link to the post so you can actually see that sort of timestamp, that moment in time when I realized that we had to build better cancer communities. Over the years, I've continued my advocacy work, writing online, and the way that I found my way to Massachusetts Health Quality Partners is very interesting, because I actually responded to a post that they put out through social media channels asking for people in Massachusetts that might be interested in joining their consumer health council, you know, to sort of raise your hand and volunteer. And I had never heard of MHQP or Aligning Forces for Quality until that moment, until I saw that Facebook post fly by in March of 2012. And I couldn't believe that I had been working as an advocate in these different circles in the Boston area, and unfortunately had never heard of MHQP or Aligning Forces. And I like to say that Facebook post in some ways really solidified the direction that I'm taking my cancer advocacy, because of the work that I've done with the Greater Boston Alliance of the Aligning Forces for Quality. I've learned so much in terms of building networks and community and storytelling and how to work at the hospital level or at the community level to make changes in the way that care is delivered for us today. And I've been able to take that and focus a very sharp lens on the cancer community and begin to work on things, you know, that we've heard about already in today's webinar about medical safety and readmission rates, things as a cancer advocate standing on my own I would never know about. So MHQP Aligning Forces have given me a framework to better educate myself to become a better advocate, particularly in the cancer space, and as a way that I can sharpen my story and come back to my community and say, these are the things that we should be working on. These are the ways that we can make sure that chemo medications are delivered effectively and safely. This is the best way that we can work together with our healthcare teams to build long-term healthcare plans. This is, as advocates, this is how we can help when a member of our community is being discharged from the hospital. These are the things that we should be looking for, so we know that when they leave the hospital, they're ready to go and they're not at risk for being readmitted at any time in their recovery. And it's, as I've been able to network further with Aligning Forces for Quality and MHQP, these are the kinds of things that as an advocate, as you grow on your advocacy journey, these are the topics that we have to come back and work on and become better educated on, so we can be the most effective advocate that we can be. And then finally, I would just like to close by saying I look back on my cancer journey and see these 3 points as really amazing turning points for me that have pushed me further into the cancer advocacy world knowing that sharing my story, encouraging other survivors to share their story and become more involved in their healthcare communities, that I know that we can collectively make a difference and make things a lot better for the cancer survivors of tomorrow. So thank you for your time. I really appreciate it.
Thank you so much, Alicia. I, for one, feel really fortunate that we have all these incredible speakers, advocates on the line here today who have made impact in their efforts and also continue to make impact in sharing their stories with all of us. So thank you, Alicia. And we have one more storyteller advocate today, and I'm just as thrilled to introduce you to Patty Black from the Oregon Aligning Forces for Quality community. Patty?
Thank you, Deborah. A little bit about myself. I coordinate the program of Patient and Family-Centered Care, as well as a very robust Patient and Family Advisory Council at Peace Health Medical Group in Eugene, Oregon. And I've come to this work in part by the story I'm about to share. And by sharing my story today, I hope to encourage other patients to find their voice much sooner than I did, and to use that voice to advocate for themselves and others for safety and quality care. I also hope to encourage those in healthcare to make apparent to all their patients a contact person, a department, a phone number, in case those patients are not getting the help they need. About 10 years ago, I got really, really sick. I had excruciating pain shooting up both my hands, through my arms, and into my back. My primary care doctor thought that I had carpal tunnel syndrome. That made sense, and referred me to a neurologist. But the earliest appointment was over 2.5 months out. So I waited and waited and got much worse. None of the anti-inflammatory drugs prescribed worked on me, and soon the pain medications had little effect. I couldn't use my hands, I couldn't hardly walk, I could barely eat, and because my esophagus was so inflamed, all the while I kept trying to get my doctor to get me in sooner to the neurologist. But I was told I had to wait, just tough it out, quote unquote. Then came the appointment. I took the last appointment on a Friday at 5 o'clock. And by the way, I will never do this again. My doctor came into the exam room, took one look at me, and started shaking her fist in the air saying, "I don't know what to do for you. What do you want me to do?" And then the shock and the horror look on her face, probably mirrored in mine, she turned and she left the exam room. Well, I waited in that exam room for 20 minutes for her to come back and say, "Gosh, I'm sorry, I really lost it," whatever. But she didn't come back. I was prepared to make a joke saying, "Well, gosh, everybody's entitled to a bad day. Obviously, this is one of yours, laugh. And then, but let's make a plan. Let's work forward. What do we do next?" I never got that opportunity. No one came back in that room for me. She didn't come back to apologize. She didn't even send a medical assistant back letting me know that the appointment was over. Finally, I got the message, and I left the exam room, and I went out into the outer office, and everybody was gone. I was totally alone. I looked around for some bulletin or brochure or posting or something to say, "In case of an emergency, call this number if you need help," but I didn't see a thing. So what did I do? I went home and I went to bed. Well, a couple of days later, I hadn't heard anything from my doctor's office, so I started calling every neurologist's office within a 100-mile radius to see if somebody would help me. Actually, I was begging. I didn't need a referral with my kind of insurance, and I promised them to bring them cash. I even was joking around saying, "My God, I'll mortgage my house. Just somebody see me." And every single office said, "No, not without your referral." And my doctor refused to give me that referral and told me that I needed to wait for my original appointment. But at that time, that was still 40 days out, and I was getting incredibly worse. So you can imagine how excited I was when a couple days later, a neurologist called with an opening the next day. Oh, my God, I was so excited. I called my doctor's office and said, gosh, here's their fax number. Send them the referral. I can get help. They'll see me tomorrow. My office said, okay. But later that day, I got a phone call from my doctor's office saying that I had an appointment the following afternoon with my original neurologist. So I guess a miracle happened. But let's fast forward after 2 unneeded carpal tunnel surgeries later. It was during my post-office visit with my surgeon. He noticed how sick I was, and he asked me to tell him my story. After I did, he sat there very quiet and sat there and thought. He said, you know, he said, I'm going to make a phone call for you. And he called me into a neurologist's office. 3 days later, I had an appointment. Eventually, I was diagnosed with very serious autoimmune disorders and told I probably had 2 years to live. By then, my lungs, kidneys, esophagus, liver were all impacted. I was put on autoimmune suppressants and huge doses of prednisone for 1.5 years. And then, this is a miracle, it just stopped, and I got better. But because I was on the suppressants for so long, it enabled a real aggressive cancer to grow. And again, I heard the words, you probably have 2 years to live. By that time, I was stage 4. So let's fast forward 7 years, 1.5 years of chemotherapy and radiation therapy later, I'm still here. So I'd like to share this part. Right after my carpal tunnel surgeries, I severed my relationship with my primary care physician and got a new doctor. And that doctor was wonderful. He modeled to me a perfect provider partnership. He said to me, Patty, you are the most important part of your healthcare team. You will learn more about your autoimmune disorders than I learned in medical school. Will you share with me what you learned? Oh, my God, this was music to my ears. What he did, he empowered me to take a proactive role in my health. He was a partner, and he gave me a voice I wish I would have found earlier. But I tell you, I have been passionate about that patient voice, and I've been passionate about true collaborations between patients and doctors. And it won't surprise you to know that I have great concern regarding access to care and referral issues. You know, I have learned through these experiences. I have learned that, 90% plus or minus healthcare providers are all wonderful, hardworking, caring people. I have learned that when I'm really sick, I need an advocate. I wasn't able to do it by myself. That's why I think health coaches and healthcare navigators are really important roles now that we patients can have access to. I have learned that there are many opportunities for improvement, and I have learned we need to listen to and respect what our patients share. I wasn't listened to, and I was really harmed. You know, sometimes I hear people say, well, let your PCP know. But what if it's your PCP that's the problem? There needs to be a safety net built in for patients, and they need to know how to access it. As I've mentioned before, we have opportunities for improvement. And I'd also like to share that it can be a little difficult to share your stories. When we do, we relive that experience again and again. But by talking about it, by sharing our stories, that's when we can expose those areas where we can come together and collaborate on making positive change. Thank you for listening to my story.
Thank you so much, Patty. As you can see on her slide, we highlighted the elements of a story to show how Patty's story exemplified those 3 elements, making it personal, making your goal clear, and using facts to round it out. I think it's clear to me that each of the speakers today, it has a unique story, but those three elements were common to all of them, and each of them did what Dr. Cutler highlighted in terms of making the story about them, but then bigger than them as individuals. So I'll just take a couple more minutes to highlight some resources that we have available, and then we'd like to open it up for questions. So just briefly, as I mentioned, there are some resources on the Aligning Forces for Quality website, and the address is there at the bottom of the screen, forcesforquality.org. There are some information there for additional storytelling resources, and there's a sample script that kind of highlights what you learned on today's webinar, the key elements of a powerful story, and how you might set it up to make sure that all those key elements are there. So those resources are there for you to use. They're free and available to everybody on the website. So I just wanted to open it up now to everybody. I think we're going to highlight a couple of different ways you can ask questions. If you look on your screen, there's a chat box there or a Q&A box. Feel free to type in your question there if you'd like. And as folks are doing that, I think Tara has taken everybody off mute. So unless we get a bunch of background noise, we'll leave the lines open. And I'll stop and see if there are any questions. And if you do ask a question, if you'd like to ask it of somebody in particular, that's great. If not, we'll just see who on the panel is best suited for it. So any questions? Okay, well, here's a question for our panelists. So I'll see if there's one of the speakers who'd like to take it. But can you describe a challenging situation when you tried to tell your story? Like an example of when the audience wasn't particularly receptive to it. And what did you do then? So would Alicia or Kathy or Vizaskia or Patty like to chime in?
Well, I can say, this is Patty. You know, I know my story is particularly difficult for providers to hear. They really care about good care, and the fact that I didn't get it from my primary care physician really hurts them. And so I have learned to be very careful with the language that I use. You know, instead of saying, gosh, you know, I could have lost my life, I say I was done harm. And so I think it's particularly important knowing your audience and knowing what words can be highly emotive.
Thanks, Patty. That's great advice. Even though the lines are open, if it's loud where you are, if you would mute your line individually, that would be really helpful. You can do it on your phone if you're on a cell phone, or dial *6 to mute your line. Are there additional questions?
I can comment on that last.
Great.
The last question that you asked. One thing that I didn't mention in my presentation, but I think don't ever discount the power of your own story. So you have to believe in your story. So even if people might not relate to your story, or you know, you might not be making that connection that you feel you need to make to provide the best value, don't minimize your story, you know, to fit their needs. So if it's too much, if it's overpowering in some ways, then you have to figure out a different angle to make that connection with your audience. But don't discount or don't don't shy away from your own story, I guess is what I'm trying to say. You have to make sure it's your story, believe it, you know, no matter what happens, no matter what kind of pushback you might get from the people that you're dealing with, you know, don't discount the power of your experience, even though it might be just an experience of one, it's still very, very powerful in what you can do.
Thank you, Alicia. That's a terrific point. I'll pause and see if Vizaskia or Kathy wants to weigh in on that first question.
Yeah, this is Saskia. I would love to chime in here. I do speak at quite a few different events and tell different stories, and I think that the points were made that you have to think about the language you're using and the wording, because I speak quite a bit about racial and ethnic disparities, and sometimes that could really stop people from listening. So sometimes I have to alter that and connect with what their interest is and their passion. And the thing about it is if there's ever an opportunity, and I think you see a person's disengagement, or sometimes people will speak a little harshly towards you about a story, I think it's always important to try to engage them in the conversation or in the story, or asking questions can help get them engaged, and then it can also help guide you in how you would best communicate your story to them.
Thanks, Saskia.
Deb, this is Kathy. And I think as a nurse, I get a little bit of leeway sometimes about how far I can go when I'm telling my story. In one presentation for an infection prevention organization, I thought I was provocative. I thought that the things that I brought up in the form of questions, I didn't make accusations and I didn't make comments. I asked questions. What if infection control nurses spent more time at the bedside, which is something they don't do as a matter of practice, and I actually was well received. On the other hand, I had a colleague who was in a presentation in Maine, and I'll leave the names out, but I was part of a panel presentation with him. He was very well informed and was doing a particularly great presentation, and his presentation was offensive to an infection control nurse in the audience, and he was essentially slam dunked during the presentation. So reactions can come when you least expect them, or you can actually use your presentation and maybe some suggestions or comments or questions to challenge your audience and be prepared. So it can be difficult sometimes, the responses that we get from our presentations, and I agree with the others that our wording we have to be very cautious with our wording and how we present these things. So I'll just leave it at that. Thank you.
Thank you, Kathy. Any other questions on the phone line? Because there's one here. So one question is, some people may be involved in a lot of different work and efforts and are having a hard time trying to identify what their best story is. Do you have any advice or tips for finding what story to highlight?
This is Saskia. Prior to sharing my story today, I was going in a whole different direction. I was going to talk more about my husband's condition, and I was basically going to be telling his story instead of my own story. And I think what helps is when you can bounce it off of a person that can give you feedback. And I will tell you, my story evolved last night probably, and it evolved at probably 8 o'clock or so last night. But I had met with someone that I respected on the phone, Bill Winfrey, who's on the line today, I believe, who helped me find out what was my story, not just my husband's, but oftentimes if you can sit and talk to someone that you respect, that has some clear thinking, they can help you. Because sometimes you just relive all these different stories, and it can be confusing, but it was really an aha moment for me when Bill and I were speaking, and he said, Saskia, it's your knowledge is power binder. It's that binder that empowers the changes and that help you become knowledgeable about the condition and the structure and the discipline, everything that I needed to be the best advocate for my husband. So I would encourage you, if you are confused with which story, because we probably have many, is to talk to someone that you respect, that somebody has a clear head on their shoulders. Because I tell you, I have things bouncing through my head all the time. I'm already thinking about 12 different things I'm going to do later today. But they can help you refocus as well. But it's always key to be a personal story is always the most impactful. It's easier to tell.
That's great advice, Saskia. Did anybody else want to chime in from the panel?
Yeah, I'd be happy to add something to that. I agree with what she just said, but also I think first of all, the subject of your event, if you're going to speak or share a story at an event, has to be key to your story. So most generally, when I go anywhere and I'm part of a presentation, I share my father's story. It's what brought me to this work, and it's very personal. But on the other hand, I've been involved in so many different organizations and different presentations that I found that some of my own personal stories, which I never thought amounted to a hill of beans, basically, are more suited for whatever that event is. For instance, choosing wisely. I've been in several presentations that we've just specifically talked about choosing wisely. So my dad's story only then becomes part of my introduction about why I'm involved in the work, and then I will use a personal story to demonstrate the need for choosing wisely. So it's again, it's who your audience is, what the subject matter of the event is, and then you take it from there.
That's a really great point, Kathy, that a lot of how you frame your story is about the audience and what goal you're hoping to achieve with that particular audience. I know Patty mentioned that sometimes she speaks to patients about taking an active role in their care, and sometimes to providers, and the way she frames her story differs. So sometimes identifying both what your story should be and how to frame it depends on to whom you're speaking. Right. One other question came in that it was striking that Alicia was not aware of her local alliance before you saw this Facebook post, and it's a good thing you did. But what could alliances do to help make other patients and consumers aware that there are organizations that are engaged in this type of work? Any ideas from the panel?
Would you repeat that?
Sure. So the question was, what can alliances do to make patients and consumers aware that they, the alliances, are doing this kind of work to improve quality?
I'll actually start, I guess, answering that. If I was very surprised that I went as long as I did without knowing about the Greater Boston Alliance, and I think it's just it's a matter of networking, but it's also making sure that you're sort of connected in the communities. So you might need to sort of reach outside your comfort zone with the work you're doing and try to build alliances, if you will, with other organizations or do meet and greets or sort of open door or events where you're publicizing your work. Because I've said this multiple times with different organizations that I've worked with, that sometimes patient advocates sort of stumble onto these organizations, and it's just a sort of a matter of serendipity that it occurs. And I think we need a much more structured way of networking and making sure that we are sharing our stories outside of our core communities, because that's the only way that we're going to build exposure on many different levels. So.
Great, thanks,
Well,
Alicia. Go ahead.
Well, this is Vidaskia. I've been involved with our Washington State Washington Health Alliance since probably 2006, and I have watched them grow. And we have our consumer engagement that's representation of basically our whole state and diversity within our consumer engagement team. But we also do quite a bit in terms of keeping our community informed. We do health disparities reports for the last 2 years on reaching out to racial and ethnic populations. We have our tools. We're very information technology savvy, so we're very involved with having our stuff on Facebook, and we do some Twitter, but we also have some really significant programs that are out in our community. We do the Choosing Wisely campaign. We also have our, like I said in my earlier presentation, Own Your Health, which is education to the community. It's easily accessed on the internet, has videos. I've watched our alliance grow and reach out and become such a respected resource that our communities and the people within our communities look to them. And there are many, many stories that are shared. And I think the most significant thing is we don't ever think we're there. We're always looking for different opportunities to grow our alliance, develop tools that will create healthier people within our state, within our communities, so that they are literate about their own health as well. So I think it's developing a community engagement team that's actively involved in the community but also respected within your alliance. And I think in Washington State we've done that.
Thanks, Vidaskia. Well, we only have a couple minutes left, so I'll pause and see if there are any other questions or comments from folks on the line.
Hello?
Yes. Oh, sorry.
Hello?
Yes, go ahead.
Yeah, this is Poppy Ockford from Maine, and I tried to type in my question. My computer died on me. I'm sorry. But my question is this. First of all, thank you so much to the folks who have shared their stories. It's really been, it's been excellent. But I'm sitting here thinking about my real-life experience, and I'm just curious, like within the next, let's say, 3 months, for the panelists, I know you've all shared how you've shared your stories and how it's been, you know, it's been really empowering. But right now, today, in your lives, say in your communities, where have you or where would you like to take your story where you think it could really start to drive? We're all focused on the triple aim goals, you know, better patient experience, better quality of life. Where would you go? Where would you take your story in your community right now, today, to drive those types of that type of transformation?
Would the panelists like to take that?
I would go right back like I do on a weekly basis and keep going back to the medical center where I've been treated and do a lot of volunteer work and continue to push my story and work to help other patient advocates build their story by staying as involved as I possibly can with the Patient and Family Advisory Council at the hospital here in Boston. But I also know that I have to figure out a way to move beyond that to make the greatest amount of change. So is it, you know, going to other alliances and sharing my story and the work that I've done with them. I think for me it's an iterative process. So over the next 3 months I'm going to continue to see where I can make the most inroads by building the biggest community. I don't know if that answers your question. I hope it does.
Alicia.
This is Kathy. I'd like to just answer that question, too. Thanks for asking, Poppy. I don't know where I would go in my community to get the greatest impact from sharing my story, but I have I've never given up on the possibility of sharing it in the state legislature again, or beyond that at the Senate on the federal level. I think some of the issues that I'm looking at and hope to see a change in will require mandates from the state and the federal level, CDC, in order to stop these multi-drug resistant organisms from spreading and continuing to grow in numbers and problems. So that's where I would, if I was going to go somewhere today, it would be to my state legislature, or maybe even to the federal level, because I think big too. So basically, that's where I would go today.
And this is Vazaskia. I'll chime in again. For me, it's part of my day-to-day life. I work for our healthcare authority, which is the Medicaid company, and I also sit our Governor's Interagency Council on Health Disparities, as well as the Alliance and our Health Benefits Exchange. And I'm always doing work around health equity and advocacy and quality care. And so I have been able to share prior a lot of information about my husband's story and our journey, but I haven't been as deliberate about telling the story that I shared with you in the path for truly active advocacy based on knowledge and power, not as much as it could be. And so I think for me, I would be taking this message more and more into the community, as well as utilizing it as a tool to help guide some of the decisions that we're making and providing resources to those that are in the greatest needs, in those that are not, but are seeking the literacy level and the advocacy skills for folks that they care about, or that they're advocating for, or need to advocate for. So it's part of my day-to-day world, but I believe that there's ways that I can even be more and more effective with sharing this aspect of my life and my story. And also, one thing that I didn't share, and I will share since you asked, Poppy, but there were a host of different experiences that my husband and I dealt with the medical community and providers, and the ups and downs of his treatment and the patient-centered care and the things that we had to triumph over. And so we are putting his story together in a book, and I think that I might be entitled to a chapter in that book as well. So I think that's where we're going to go and hopefully help change lives, or at least educate folks.
Well, that's a great note, I think, to end on. I know there's probably more discussion to be had, but we're out of time, and I want to thank those of you who've hung in with us through the webinar. I think this has been terrific. I want to thank all of our panelists for presenting, for Michael and HCM strategist for presenting the basics with Vazaskia, for Vazaskia and Kathy and Alicia and Patty for all sharing their stories, and to all of you for participating. You know, we talk a lot in healthcare quality improvement about the facts, and the facts are critical to moving improvement forward, but they often aren't as powerful as when they're wrapped in the human story. Sometimes you can hear the same data over again, but it doesn't really hit home until you can put in the context of a person's life, or a family, or a personal experience. So I think the better we get at capturing the data and the facts within that human context, the better chance we'll all have at driving change. So I want to thank all of you, and the recording for this webinar will be up on the AF4Q website in a day or two, and so I'd invite you, if you'd like, to share that with other folks who might be interested in it, and as well to take advantage of the resources that are available on the website. Thank you all and have a great afternoon.
Thank you, Deborah.
Thank you.
Bye.